Hello, everyone, and welcome to our YouTube channel. Today, we will discuss what are the signs and symptoms of dementia if someone have dementia, and what are the different types of dementia. As we discussed last time, our brain have four major lobes, which is frontal lobe, temporal lobe, occipital lobe, and parietal lobe. So, mostly, if your frontal lobe is affected, you will lose the functions related to your frontal lobe. If your temporal lobe is affected, you'll lose the function related to your temporal lobe. So it again depends on the which side of the brain is affected, and you have more symptoms related to that side of the brain. As we discussed last time, dementia is due to the abnormality of brain cells. It is due to the abnormality of brain cells getting shrink, and they cannot do the function, they cannot do the blood supply, they cannot do the thinking they used to do for our body because of the abnormality of those brain cells. Some common symptoms you'll see in an initial stage could be confusion, could be memory loss, it could be losing the road sometime if you're driving and you forget where you were driving, or you forget where you were going to before. You used to remember those roads, those pathways, but now all of a sudden you cannot. You may struggle with financial issues, you may not do budgeting as you used to do. You may struggle with critical thinking or thinking about your life or solving problems. You may struggle having some problems and solving those problems which you used to do before normally. You may also struggle sometime with communication. You may lose some words you used to talk, or some dictionary of your words started getting fade and fade little by little by little. Again, as the disease progress, those issues, those challenges get more worse and worse and worse. Again, memory loss could be something everybody struggle with. Everyone in our life, we do have some time memory loss, but that is like one episode, two episode, three episode, or due to something going on in your life. But if it's continuously getting worse and worse, and you're forgetting single things, for example, you're going to your kids meeting and you forgot that today was your kids school meeting, or you forgot that how to go to your home, which you used to remember for next last 20, 30 years. So those are the issues. If they're getting worse, that means you need to go and check it out and get assist to find out what is wrong with your brain that you're struggling with confusion and memory loss. Now we'll discuss about there are types of dementia, that there are four different types of dementia. The common one which you hear mostly is Alzheimer's. It called Alzheimer disease, which is 60% people at time living with Alzheimer disease. So it's very common. Then the other diseases of the related to dementia is frontotemporal dementia, which is related to your frontal lobe and temporal lobe of your brain. Vascular dementia, which is related to the blood vessels of your brain, and then Lewy body dementia, which have other two subcategory. One is called Parkinsonism disease dementia, and another is called dementia with Lewy body. Again, the type of dementia, the lobe of the dementia brain which is affected, you'll get more symptoms related to that. Alzheimer disease mostly affected to your occipital lobe, so you'll have more losing those function which your occipital lobe of your brain control or handle. In our upcoming video, we'll discuss more in detail about Alzheimer disease and then further dementia. Thank you, and take good care of yourself.